up, everybody? You know who this is. So, y'all saw me in here. Sorry about the light. I have to work with the room light, so it's a little dark right above me, which does not help the fact that I look like I can do an Aldi's haul in these bags. Apparently, I know I was in the hospital last week. That was earlier this week. And I was discharged on Wednesday. I'll have to go back and look. What I didn't know until 2 days ago or 3 days ago is I made a video for y'all. That was nice. I don't remember doing that. Y'all, I block out so much. I'll have to rewatch this again at some point once I've forgotten. I'm back in the hospital. Got here last night. Well, yesterday afternoon, probably about 3 or so. Fluffy brought me in here. So thank you to her. Mrs. Sarge had to work. And had to work again today, but she will be here tomorrow morning, so I'm excited about that. Did y'all hear that? It's my text message. So I still wasn't feeling right. I was feeling very tired. No energy. I mean, I could find the energy to get up and do something, and by the time I got to wherever this thing was that I was going to take care of, I was done. Of the showers I took on the days that I was home, at least 2 of them, and it's a stand-up shower, but I had my little stool in there and was sat down, just exhausted. So yesterday, which was Saturday, I was kind of debating back and forth. Do I go in? Don't I go in? I didn't want to waste anybody's time, to find out that my platelets were normal. That was yesterday. So clearly, as you can see, when I came in, they were at 12,000, which is a little higher than what they had been at 5 and 6. But as the doctor explained to me, it's like, well, 12,000, we're ready to admit you. You're still at that risk for spontaneous bleeding. Or you can go home and come back when you feel worse. I'll just go ahead and stay, because it's going to get worse, and then I'll have to go through all this. I don't know what was up with the department of the emergency room I was in. It was scary. It was scary quiet. The room I was in was missing equipment, had some things, didn't have other things, computer didn't work. They told me the power or something of some other rooms ran off of it, and it was never completed, and it was weird. And I was there till about, I guess I got to my room at 1 o'clock this morning. So, yeah. To explain, for those of y'all that don't know exactly what I'm in here for, I tried to look some of it up on my laptop before I started recording and take some notes for you. What I'm in here for is called ITP. Nurse Linda, I know you're watching. I'm going to need you to correct me if I say anything wrong, but don't embarrass me. So ITP stands for idiopathic thrombocytopenia or thrombocytopenic purpura, and it's an autoimmune disease. And basically, from what I'm understanding, your immune system gets in there and starts, that's what attacks things that don't need to be in there, that are getting you sick, is your immune system. And at some point, it can put a marker onto one of your platelets, which has then marked your platelets as an enemy that it needs to get rid of. And the spleen will then destroy the platelets, which I'm guessing is what's going on with me now. I came in at 12,000. I've had several medications. The IVIG, which is the immune globulin, they tried that a couple of visits ago, and I don't know what happened because I kind of went straight to sleep, but it wasn't good, and they're not going to give me that again, so that's fine. Prednisone, which y'all know I've hated this prednisone. The weight gain, the thing back here, my face, I lost 5 pounds in this past week with everything that happened, but that is not enough. And now they're loading me full of dexamethasone. Like this doesn't really stay hooked up, but yeah, that's where they're giving me the IV dexamethasone every day. And from what I've read, the side effects can be pretty much similar. The weight can be a problem again. Before I came back in this time, between these two last trips, I had, and I'm not telling you anything to disgust you, or like, why would she tell us that stuff? Whenever I talk about any of my health issues, there may be some things you find too descriptive, but to me, that's the stuff that helps someone that thinks, is this something I'm going through? But isn't ready to start, actually go out and see a doctor yet. Which I am not, by the way. But yeah, when they sent me home on Wednesday, that night and the next day, y'all, there was nothing staying down and nothing staying in. And when I say nothing, I've had times when my stomach was upset before, or I was getting sick, and I'd try to drink a soda or a coffee, and it would come back up. Y'all, I drank bottled water. And I could swallow it, I could feel it, and then I've never had that before. Just as clear coming out, elsewhere. So that was stressful. That had me worried about what was going on with platelets and stuff. A little bit more blood from my from coughing. Had some more bruises, but that was what they did to me. Kind of see it right there. That was what happened last time I was in here. So, I forget exactly where I was going with everything. So, I have been through several of the recommended medications for ITP. I'm kind of having a problem with a decision that I may or may not be faced with tomorrow, because I don't know what my doctor's recommendation is going to be or how they're going to feel about my thoughts on it. The next one that a hematologist came in and talked to me about today I want to say is it rituximab? It's an IV drug. The information I got is that it's a 6 to 8 hour infusion. It's done in the treatment room, in the infusion room, which I try to explain the quote unquote PTSD effect that I've had from that, as in I've had to throw away clothes that I've worn into those treatments. I had to use a different toothpaste on the days that I went into chemo. Yes, I understand this is not chemo, but it's given in the same area. You sit in a treatment chair for 6 to 8 hours, and it has side effects. And yes, they have drugs they can give you before the treatment starts to prevent the side effects, and I am here to tell you that doesn't always work. You know, I'd go in for chemo and be given the stuff beforehand and threw up in the treatment room. It only happened once, I think, but I had a tablet, like a Galaxy tab, went out. I can't use it anymore. I can't even look at it. Some headphones, a blanket. It's a blanket that my mom made that I will keep and have always, but I can't. I used it during my treatments. So I have not had a chance. I've told Mrs. Sarge everything that's happened today while she wasn't able to be here. Like I said, she'll be here tomorrow, and that's when we'll get a chance to actually, sit and talk and it not be through text and discuss and whatnot. That's when decisions will actually be made, but this is not something I'm wanting to do. And unfortunately, that's not like chemo. I'm guessing, I haven't asked anyone this, but with the chemo I could say stop, I'm done, and be told you realize you'll probably shorten your life, and say yes, and that's that, and that's what I did. This type of infusion is not the kind where I can be like, I don't want to do that right now, I'm just gonna keep on living, because my platelets are dropping low, and eventually, sooner rather than later, that's just not going to go well. I did ask the hematologist when I was in here about something else that I was told is a form or a way to treat this, a treatment for this, and that is to remove the spleen. She did give me a bit of information I didn't know, which is that the spleen fights off infections. Not just the basic infections. I mean, it may assist with that, it may be part of that, but I also know like infections that can get to the brain and stuff like that. But that is countered by some immunizations to prevent that. She's in contact with my oncologist, Dr. B, and was going to go and talk to him today. About how he thinks I would do during that surgery, because there's a lot more to consider. They can't just consider this ITP. The whole cancer thing has to be considered. I've had a couple doctors tell me they think the ITP is related to the cancer now. I've had a couple that say no, it's not. I've had a couple, well, I've had one that says they don't think the ITP is caused by the cancer, but that the cancer is affecting how the ITP is working, progressing, whatever you want to call it. That makes sense to me. So obviously that surgery would not even be an option if that's something that Dr. B is like, her body was, it's not going to survive. It's not going to make it. I don't know. Maybe it still would be an option to me. I don't know if he actually says that. I don't know the legalities of all that. But I just don't feel willing to spend the rest of my life doing this. I stopped chemo to prevent doing this kind of stuff for the rest of my life. And now I have an autoimmune disease that's putting me in the same situation. So, something else that was discussed, I don't think you can see it because I put on so much weight, but I noticed a tenderness over here. And it has a more solid, I guess, feel to it than the other side. And people's opinions on that are changing like their underwear as well. Mrs. Sarge was the first one I had look at it. She didn't seem to think it was anything, too major. And I've had doctors since that have pretty much said the same thing. What makes me nervous is the doctor I had in the middle who, when I told him that tenderness was there, and this was at the ER last night, he took one feel of it and said, that feels pretty firm. Do you think it feels pretty firm? And I said, yeah, I do. And he said, yeah, I'm willing to say that is a tumor. That is a cancerous lymph node. And that tore me down hard last night. I mean hard. Yes, Sarge Dearest was sitting in tears. And honestly, like the fact that I have cancer is there. The cancer is spreading. I mean, it is what it is. But this was the first time, if that's true, if that is true, this was the first time that I was actually able to feel that. Do you know what I mean? I was able to feel what was wrong. My cancer has been in my colon and my lungs. Even I couldn't get that skinny. I can't feel that. So yeah. It's really took me back for a minute. Like I said, I'll be glad when my wife is here tomorrow. Today made for a pretty long day. I was talking to my nurse just now, and she was giving me my medications for the night, and we were trying to count up how many of this, that, and the other. Of course, she had it all on the computer. I was asking questions, so we were just going over it as she was administering this stuff, which takes a while. And it didn't even occur to me that I haven't been here 24 hours yet. Like, I thought I was 2 days into this road trip. But I didn't get to this room until 1 a.m. yesterday. So that's where everything is right now. There's not much going on. This video is almost already 20 minutes. I miss you all. I'm having a hard time making videos right now, and I don't know why. I think part of it is that I like doing the happy, silly videos. I like making everybody smile. You know, that's what I love to do. But I feel so thrown off by this whole ITP issue that's come about. I don't even know how to deal with it. You know, there's other things going on too that are pretty stressful that I'm trying to figure out how to deal with. But, you know, this is definitely up there. Like I said, I have decisions to make, and they're going to have to be made pretty fast. The hematologist, I actually had an appointment with her this coming Tuesday, and should I choose to have that treatment, she wants me to get it done, you know. But that requires me being out of the hospital. And I say it like this, like discharged from the hospital, but the treatment room for the infusion room is actually downstairs in this hospital. So it would just mean the discharge paperwork needing to be done. And so I don't know. She said she'd be back Monday. Hopefully she is. Hopefully with anything that I want to hear. And move on from there. I appreciate all the comments. I'm not going to lie. I have not kept up with comments recently. I've barely opened my laptop since I've been home from Pennsylvania. That's when everything just kind of hit the fan. There's not too many humorous videos I think I can think of to do from here. I was going to walk down the hallway and that was boring. And then I thought I could be like one of those crazy people on Facebook that like they're trying to tell their boss or something they're in the hospital, so they've got like their earphones stuck up their nose, wrapped around their head, and like the USB port taped down to their arm looking like the IV. It's an IV, y'all. I'm seriously here. Not that I have a boss, said Mr. Sarge. You find out some random interesting facts when you're really bored and you're just watching TV and surfing the web. Like, here's one, and then I'm going to go. And I'll have to come up with some different ones and make a happy video. I think that will help put me right in the right mind frame. But the one that was, y'all know Jodie Sweetin, who was the actress on Full House and now on Fuller House. Well, an episode of Everybody Loves Raymond was on in here, which I don't even really care for the show. At the end, it said someone Sweetin. I forget the first name. And I was like, oh, I wonder if the daughter on Everyone Loves Raymond is related to Jodie Sweetin. Now, turns out they're spelled completely differently. Well, one's an E, one's an I. But in doing that, I found out that the girl that plays the daughter on Everybody Loves Raymond is actually the sister of the two twin boys that play the sons on Everybody Loves Raymond. You're welcome. That is something you know. So I'll try to come up with more that's better. That was kind of lame. So I'm going to go. The nurse left me these things because, as it turns out, I have a reaction to. I got a heart monitor this time. I don't know why. They didn't give me one the last 2 times. Y'all, the ticker seems to be one of the things that's still working, but I had a reaction to. I can't even tell from there I had a reaction, but it's all red and like bumped up, and so she gave me these. She's like, "I'm not gonna hurt you. Here you go." Anyway, that's it. I will talk to y'all again tomorrow. I asked Mrs. Sarge to bring postcards and mail, and then I was feeling down again, so I was like, no, maybe not. Like, I can't even make myself do a video. But maybe I can get my spirits up, maybe get on here and get back to some of the comments and catch up on y'all's videos. I can't lie, I haven't done that either. Perfect time, right? So, I love y'all. If you watch this to the end, thanks for sticking with me for the last 25 minutes, 25 and a half minutes. And, hope y'all are enjoying my scenery. And we'll talk to y'all again soon. Peace.